Minister of Health Dr. Frank Anthony, during today's COVID-19 update, said there are reasons for concerns as children as young as 1 month old are contracting the severe form of the deadly COVID-19 virus. He said this is becoming a disturbing trend as 4 children are currently hospitalized with a severe form of the disease.
While most of the cases so far that we have seen have really been mild, over the last 2 weeks or so, we have seen a disturbing trend. And right now, in our hospitals, we have 4 children who have been severely affected by COVID. And so we are monitoring them, and hopefully the prognosis would be good because the medical team is really working to ensure that they can provide the best care for these children.
Dr. Anthony is calling on parents to ensure that all health measures are followed to prevent their children from contracting the deadly disease.
I think it's important that we take the necessary precautions, especially with our children, to make sure that they are protected. They wear masks when it's necessary if they're going out, because the virus, as we can see, can affect children, and I don't think a lot of people have paid attention to that, and therefore it's time that we pay some attention to this, especially now that we are seeing not just the mild cases in children, but we are seeing more severe forms of COVID among the children population.
Dr. Anthony is also calling on parents and adults to take precautions to ensure they do not bring home the virus.
If children are at home most of the time, then we also have to consider the interaction of adults who leave the home, go out to work, come back in. And if those adults are irresponsible and not taking the precautions, then they can bring that infection home. So it is something that I think people should be very mindful of, because you can bring that infection home and it can affect the children who are home and also the elderly.
The minister is encouraging persons who would have gotten their first dose of the vaccine to get their second dose.
While a lot of persons would have received their first dose vaccines, those that have become eligible for their second dose, we'll want them to come and get those second dose. And that includes persons who would have gotten their AstraZeneca vaccine and their Sinopharm vaccines. So once you're eligible for your second dose, please come and get it. In terms of Sputnik V, we are working to get the second dose of the vaccine in, and we are working very hard to see how we can source these vaccines and bring them in. Working with the suppliers, trying to confirm the dates. But as you know, these vaccines can be administered from 4 weeks right up to 12 weeks. And most of the people who would have received their first dose Sputnik V, while they're going to become due maybe in another month or so, we want to make sure that we have these vaccines in before that to ensure that people can get their second doses on time.
As of yesterday, July 1st, 48.1% of Ghana's adult population received their first dose of the COVID vaccine, while 23.1% have been fully inoculated. For Headline News Update, Bibi Bacchus.